2. Hey everyone, and welcome back to Family Everyday Survival. Today, we are re-diving into a super important topic, basic first aid that every single family member should know. Accidents happen, especially with kids running around, but being prepared can make all the difference. Knowing these simple steps can help you stay calm and take control of the situation until professional help arrives. Let's get started. First up, let's talk about cuts and scrapes, probably the most common injury in any household. The first step is always to stop the bleeding. Grab a clean cloth or bandage and apply gentle, firm pressure to the wound. If it's a minor cut, this should do the trick in a few minutes. Once the bleeding has stopped, it's time to clean it. Gently wash the area with mild soap and warm water. Try to keep soap out of the actual wound, but clean the skin around it well. Pat it dry with a clean towel and apply an antibiotic ointment to help prevent infection. Finally, cover it with a sterile bandage to keep it clean while it heals. Remember to change the bandage daily or if it gets wet or dirty. Next on our list are burns. Ouch! Whether it's from a hot stove, a curling iron, or spilled coffee, burns need immediate attention. 4 minor burns, the kind that just makes the skin red and painful. Sloan immediately. Run cool, not cold water over the area for about 10 to 15 minutes. This helps to pull the heat out of the skin and can reduce the severity of the burn. After cooling it down, you can cover the burn with a sterile gauze bandage. Don't use ice, as it can cause more damage to the skin. And resist the urge to pop any blisters that form. They act as a natural barrier against infection. 4. Anything more serious than a small first-degree burn, you should seek medical attention right away. Fevers can be scary, especially in little ones. A fever is the body's natural way of fighting off infection, but it can make your child very uncomfortable. The first thing to do is get an accurate temperature reading with a reliable thermometer. For babies, a rectal temperature is most accurate. If your child has a fever, you can help them feel more comfortable by giving them a lukewarm sponge, bath, avoid cold water, as it can cause shivering, which actually raises body temperature. Dress them in light clothing and make sure they're drinking plenty of fluids like water, juice, or broth to stay hydrated. Over-the-counter fever reducers can help. But always check with your pediatrician for the correct dosage based on your child's age and weight. Now for a truly frightening scenario: choking. Knowing what to do can be life-saving. If someone is choking, they might clutch their throat, be unable to talk or cry, and their skin might turn bluish. The universal sign for choking is hands clutched to the throat. If the person can cough forcefully, encourage them to keep coughing, but if they can't cough, breathe, or speak, you need to act fast. For an adult or child over 1, you'll perform the Heimlich maneuver. Stand behind them, wrap your arms around their waist, make a fist with one hand, and place it just above their navel. Grab your fist with your other hand and give quick, upward thrusts into the abdomen. Continue until the object is forced out. It's crucial to learn the proper technique for infants as it's different. Taking a certified first aid course is the best way to be prepared for this. Finally, let's discuss allergic reactions. These can range from mild skin rashes to life-threatening anaphylaxis. Mild reactions, like hives or a rash, can often be treated with an over-the-counter antihistamine. But for severe reactions, you need to be ready to act immediately. Symptoms of anaphylaxis can include difficulty breathing, swelling of the lips, tongue, or throat, a rapid pulse, dizziness, or loss of consciousness. If you suspect someone is having a severe allergic reaction, call for emergency medical help immediately. If they have a prescribed epinephrine auto-injector, like an EpiPen, help them use it right away. Even after using the injector, they must go to the hospital, as symptoms can return. Knowing these basic first aid skills is a huge step toward keeping your family safe. I highly recommend taking a certified first aid and CPR class to get hands-on training. It's an investment in your family's well-being. That's all for today's episode of Family Everyday Survival. I hope you found this helpful. Stay safe out there, and don't forget to like this video and subscribe for more tips. See you next time.